Welcome to Mental Health Matters. This is Hwee Boon, and today I'd like to describe the mental disorders listed in DSM-V using layman terms and explain how diagnoses are made. I will also briefly describe some of the treatments possible for the mental illnesses. Let's get started. You might ask, what is DSM? DSM is the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association, and currently is in its 5th edition. The impetus to start the manual or certain diagnostics for mental disorders started in 1840 when in the US Census they found that there were some noticeable numbers of people who were listed as having idiocy or insanity. By the 1880s census, they had actually improved on it and categorized people with mental disorders in 7 categories, which is mania, melancholia, monomania, paresis, dementia, dipsomania, and epilepsy. The American Psychiatric Association then was known as the American Medical Psychological Association, and they decided to collaborate with the New York Academy of Medicine to come up with a nationally acceptable psychiatric classification. Now, this was before World War II. During World War II itself, there were a lot of soldiers who were traumatized by the war and they were shell-shocked. So the council then decided to incorporate all this information from the Veteran Health Association, as well as whatever that they have found in the International Classification of Diseases, published by the World Health Organization. And with that, the first DSM was published in 1952. Having said all this about the DSM, so what's the use for it? The current DSM-5 and the ones before that is considered the Bible for mental disorders, especially for those who are actually working as psychiatrists or psychologists. The DSM puts all the various mental disorders known to humankind in categories, and they state what are the symptoms and how you can actually make a diagnosis to see if somebody has a mental disorder or not. So to a certain extent, it's like the dictionary for the mental health practitioner. And in Singapore, the diagnosis is usually made by a psychiatrist and maybe a clinical psychologist. How do you get diagnosed with a mental disorder? First, you need to have the symptoms being described and that you meet the criteria that's needed. So like for example, for major depressive disorder, you need to have 5 of the 8 criteria listed, including the essential criteria of either having been depressed or having anhedonia, which is the loss of pleasure and motivation. It also needs to last for a certain period of time. So for major depressive disorder, you need to have all the symptoms for continually for 2 weeks minimally to meet the criteria. If you only have these symptoms for 1 week, or you have only 4 out of 8 symptoms and criteria listed, or if you have 6 of it but it does not include the essential criteria, then you are not diagnosed with major depressive disorder. So this is how it works. The DSM-5 is like a dictionary as well as a recipe book that guides mental health practitioners to see whether the client or the patient has a mental disorder. So let's take a look at the categories that are listed in DSM-5 right now. In this new DSM, which was published in 2013, you have 19 different categories. The first category, we have Neurodevelopmental Disorders. In this category, it includes disorders related to the development since birth. So it includes developmental delays, autism, attention deficit hyperactivity, learning disorders, and other neurological disorders like having Tourette's syndrome and etc. So this is neurodevelopmental disorders. Next, you have schizophrenia spectrum and catatonia. I think schizophrenia and catatonia are issues that we are quite familiar with, in that the person has delusions and hallucinations, and catatonia meaning like a person has become like a rock, has become quite immobile and has jerky movements and etc. So that's schizophrenia and catatonia in its spectrum. Next, you have bipolar disorders and related disorders, depressive disorders, you have anxiety disorders, then you have obsessive compulsive and related disorders. So a person who is obsessive or keeps cleaning his hands and etc. compulsively. Then you have trauma and stressor related disorders. So if a person has been through a trauma and is impacted, having a lot of flashbacks and etc., they are parked here. The next one is dissociative disorders. A person has gone through trauma so impactful that he or she dissociated, and it become habitual for a person to dissociate whenever there's stress, and that there are a lot of different personalities or alters that are formed. Okay, here we also have somatoform symptom and related disorders. So conversion disorder, or keep feeling and convincing people that you are sick when you are not, when they cannot actually find a medical reason for your malaise, while you are convinced that you are ill. So they are all parked here. Next, you have the disorders related to food and digestion, feeding and eating disorders, and elimination disorders. Elimination disorders are usually found in younger children and maybe teenagers. So you have issues like bedwetting, or that the toddler doesn't want to go to the toilet or has difficulty going to the toilet. So issues like that are parked here. You have sleep-wake disorders like insomnia, or you sleep too much, hypersomnia, or your sleep cycles are all over the place and you wake up at odd times, or you have narcolepsy, is parked here. You have sexual dysfunctions. It's also listed in DSM-V. Then you have gender dysphoria, not identifying with the gender that you are born with. So this applies to those who are in the LGBTQI+ groups. Okay. Then you have disruptive impulse control and conduct disorders. So issues like oppositional defiant disorder, or conduct disorder, or impulse control disorder, they are parked here. Substance-related and addictive disorders. Under this group, you have those who are alcoholic or are on drugs, drug addicts, or that they are gamblers. So all those people who have addiction issues due to substance or behaviors are parked here. Next, you have neurocognitive disorders. There's something wrong with your cognition, maybe as a result of substances or other illnesses, or that you have delirium. So they are parked here. We have the last two sets of disorders, personality disorders and paraphilia disorders. Personality disorders, which are usually divided into three clusters. The first cluster, schizoid or schizotypal, are those who avoid people and they like to be by themselves and are a bit weird. Those who are in cluster B have emotional dysregulation. They are sometimes impulsive and they have antisocial behaviors. Cluster C are those who actually have fearful responses and they try to avoid fear. Paraphilia are sexual disorders related to behavior. So exhibitionism, pedophilia, sadism, masochism are all parked here. So these are the 19 different mental disorders and their categories. I would like to help you understand them better by putting them into other more layperson's categories. So here's a list of all the 19 different mental disorders. Those that are in red are primarily disorders that improve after the client or the patient receives psychotherapy, and they include disorders like trauma and stressor-related disorders, dissociative disorders, disruptive impulse control and conduct disorders, personality disorders, and paraphilic disorders. Then you have those that are in black. These mental disorders require both medical attention as well as psychotherapy or counseling for the patient or the client to get better. And they include schizophrenia spectrum and catatonia disorders, bipolar and related disorders, depressive disorders, anxiety disorders, obsessive compulsive and related disorders, feeding and eating disorders, elimination disorders, and substance abuse and addictive disorders. People with these mental disorders require different types of medical attention. So like people who have schizophrenia or related disorders, they require medication for them to be able to differentiate between hallucinations, delusions, and the reality. When they are able to do that, they will not be confused and do not actually hurt themselves or other people. For the other disorders listed here, bipolar disorder, depressive disorders, anxiety disorders, and obsessive compulsive disorders, the psychiatrist usually finds that there's a chemical imbalance in their head and you need the SSRIs or antidepressants in order to improve the patient's mood and cognitive functioning before psychotherapy can take place. Next, you have feeding and eating disorders, especially for one with anorexia. The person literally starves himself or herself to a point whereby the body is physically in crisis. For clients and patients like that, they need to actually put on enough weight so that their body is out of the crisis, and they need to actually have certain nutritions in before the body is able to go out of the starvation mode and that they are able to function more properly and be able to go through therapy. For the elimination disorders, and especially when it comes to retentive disorders, it will actually require medications like laxative for the feces to be released before other things can be done. So it requires medication. The person with substance-related and addictive disorders usually has a dependence on the chemicals and the substance and will go through certain withdrawal symptoms if, let's say, he or she is deprived of it. The person needs to go off the dependence for the substance or the behavior in order for psychotherapy to work. Otherwise, the person will be caught in the withdrawal symptoms and there will be a lot of physiological arousal which will cause the person to not be able to respond properly in therapy. Then you have all the rest of those disorders which are blanked out in grey. Those disorders do not require any psychotherapy for the disorder to improve, but these people can also benefit from psychotherapy or counseling as an adjunct treatment. So let's say for somebody with a neurodevelopmental disorder such as dyslexia, the person will need to go through dyslexic training or education or literacy training in phonics and etc. to improve on the word reading and interpretation ability. But maybe the child will have poor self-esteem due to the poor academic performance that he or she had, and psychotherapy or counseling will then be able to help motivate the child to do well, or for the child to learn some skills or some strategies to motivate themselves or to stay resilient. A person with gender dysphoria could feel very rejected and ostracized by the society and people around them, and so they might go for counseling and therapy and improve, but it's not necessarily always the case. There are people with gender dysphoria who can do well without therapy. So in this case, all these mental disorders that are in grey will benefit from therapy as an adjunct treatment if necessary. Next, we look at a different way of categorizing them by how we name them. In my last broadcast, I spoke about how people who might find those who are aggressive without triggers or nor reasons, those who have very weird behaviors, and those who are dangerous, and they will call them or label them as crazy. So in the 19 different mental disorders that's listed in DSM-5, these are the mental disorders whom people might label as crazy, and they are those with neurodevelopmental disorders, schizophrenia related and catatonic disorders, bipolar and related disorders, especially when the person is in the manic phase, neurocognitive disorders, and those with personality disorders, especially if they are from cluster A, the schizoid cluster, or they are from cluster B, people with emotional dysfunction. For the other mental disorders, we are very familiar with them, but we don't call them crazy or psycho. We have our different pet names for them. So like people with gender dysphoria, they can be known or called as gays or aquas in Singapore. Those with substance-related and addictive disorders are known as addicts or druggies or gamblers or alcoholics. And those who have disruptive impulse control and conduct disorders, we usually will think or call them criminals because they are often in trouble with the law and they usually go to jail. We may also call them very angry people. This person has anger management problem or something. Then we have the last group, those with paraphilic disorders. We call them perverts. Okay, this is a different way to categorize these 19 mental disorders by the amount of harm and danger they cause to others or to themselves. The mental disorders in red are those that cause harm to others. So they include people with schizophrenia disorders, bipolar disorders, substance-related and addictive disorders, disruptive impulse control and conduct disorders, personality disorders, and paraphilic disorders. So those with schizophrenia, when they are hallucinating and having delusions and not having medication, they might be a harm to other people. They might listen to what the voices tell them and act on them, causing danger to the others. Those with bipolar disorders, when they are on the manic phase, when they are not on medication, they can be very disinhibited and do whatever that comes to their mind. Those who have substance-related and addictive disorders are dangerous. People with substance abuse and addictive disorders usually are very violent, and studies have shown that they are involved with a huge number of crimes that cause them to be incarcerated. So are those people in the next category, those with disruptive impulse control and conduct disorders. So these two groups are usually the ones that we find in jail. Next, those people with personality disorders can also be a danger to others, especially those who are from the cluster B. When they are having emotional dysregulation, they might feel a lot of pain and they do not fear to strike out at people. Last, those with paraphilic disorders are a danger to others, especially when this group contains the pedophiles, the sadists, as well as the exhibitionists. In this same list, you have also those in blue. Those in blue are the ones who may cause harm to themselves, and they include also people with schizophrenia, because when the hallucinations and delusions come and when they are not on medication, it may cause them to harm themselves, depending on what the hallucinations say. You also have those who have bipolar and related disorders. Maybe when they are extremely high, they might decide that they can fly and jump down a building or something. So it's possible during the manic phase. People with depressive disorders may come to a point whereby they feel that life has no meaning and that there's no way out and it's all hopeless, and then they have suicide ideation and maybe even trying to complete their suicide. So they are at a risk to themselves. People with trauma and stressor-related disorders, as well as those with dissociative disorders, tend to have self-harm tendencies. They may have flashbacks now and then, and they might actually go into a fight-flight mode and maybe rush across the street to avoid their trigger, and as a result get into an accident. Or that they feel that the pain that is caused by all the flashbacks is too much for them and they want to be out of it, so they might contemplate suicide and attempt suicide. Those with feeding and eating disorders, especially for anorexia, when they starve themselves or that they purge regularly, causes a health risk to themselves in that their health might be irreparably damaged, or that they starve themselves to death. Again, we look at those with substance disorders and addictive disorders. For these people, they are at a risk to themselves if they overdose or that they go into alcohol poisoning or something. So this is something we need to look out for. And lastly, those with personality disorders. Again, those from cluster B, whereby they have emotional dysregulation. In the same way as those with trauma, the pain caused by being rejected or abandoned, or that their identity being challenged, may cause them to go into such pain that they might contemplate suicide. Or for those who are on the borderline personality disorders, sometimes they might use suicide as a threat to stop people from leaving them, but sometimes they might actually complete the suicide successfully as well. You can't really tell whether they are being manipulative or that they are really contemplating and completing the suicide. So these people are also a danger to themselves. I've discussed earlier on those who have substance abuse and addictive disorders, those who have disruptive, impulse control and conduct disorders, and those who have paraphilic disorders are ones that cause a lot of danger to the society, and as a result there's a lot of stigma and rejection for these people. Next, you have those in blue, which are those who have neurodevelopmental disorders, neurocognitive disorders, and those on the schizophrenic spectrum. For these people, the society normally thinks of them as having something wrong with their brain, that they are not normal. So in terms of acceptance, I'm not very sure how to place it. Maybe there's a stigma about it, but of course it also varies across the different types of disorders. Like for example, someone having dyslexia versus someone having Tourette syndrome has different amounts of acceptance by the society. But generally, the sense is that something is not right, they are not very normal, and that their brain is different, so they have such problems. There's a last group which I put here in purple and italics, those with gender dysphoria. Previously, people with gender dysphoria are parked under those with paraphilic disorders. So if let's say we are to go back 50 years in time, a person who's gay will probably have to go through chemical intervention and to be injected with hormones to decrease the urge to maybe have gay tendencies. But nowadays it has become more acceptable to be part of the LGBTQ community, to not have heterosexual attraction, but it's still not mainstream and not fully accepted by people. Okay, so there I have listed all the 19 different mental disorders and try to put them in layman terms as much as I can. Hope it has been helpful to you and that you have gained some awareness about what some of them are and how they are described and how a mental disorder is diagnosed. Thank you for watching today, and I see you again. Bye bye.